COVID-19, as we all know, is highly infectious, especially healthcare providers. They're constantly exposed to people that have this infection. And although they are wearing, for example, say face masks, some of these viruses are adhering to the exterior of those masks. And when you are taking off the mask, inadvertently, you end up spreading infection.
So Indiana University researchers have come up with a solution to prevent spreading infection, and it could be a game changer for the medical field. They've invented a new fabric mask for healthcare workers that can kill the coronavirus. The secret? Tiny dots of silver and zinc. Barbara Lewis is in for Kylie Valletta this week with more in the business of health. Barb.
Gary, thank you very much. Well, this is amazing. Simply put, the virus needs an electrostatic interaction to attach itself to a mask or other PPE. So if you disrupt that process, the virus can't survive. So that's my very simple explanation. For the real explanation and what this invention could mean, I am joined by Chandan Sen, director of the Indiana Center for Regenerative Medicine and Engineering at the IU School of Medicine. And it's good to have you on the program.
Thank you.
All right.
Thanks for having me.
So I'm going to make you tell us in very, very simple terms, if you will, is how this fabric works.
First of all, the fabric has existed for about 10 years, and the fabric has been used for wound care dressing purposes. And we have been studying this fabric for its ability to disinfect a wound. And in this particular case, when the COVID-19 broke, we simply tested the fabric for its effect in neutralizing the virus. In this case, what you have is a fabric where you have metals such as silver and zinc printed on it in a given geometric pattern. So when body fluids touch the fabric, the so-called battery turns on. There is no conventional battery, there is no conventional wire. But these metal dots start acting like a battery, and they generate enough electric power to neutralize the coronavirus.
So who will use this? Is it just going to be for healthcare workers, or is there a broader use?
No, this is a multi-purpose use fabric that should be available. It's manufactured within the United States, and it should be available. It's not hugely expensive. So as far as I see it, it can be used for a much broader purpose, and as long as it can be supplied in appropriate amounts. Now, of course, the first order of business is to make sure that our healthcare providers are safe, and that would be a good place to get started. But I wouldn't be surprised if the people on the street would also have access to it and would use it for the same purposes as we have just heard when you played the video.
Okay, so how durable is this? Is this something that you have to you can use multiple times? How is it cleaned?
So in this case, the fabric is based on a polyester base. It could be anything else as well. But in this particular case, it is polyester. It's pretty durable, like any other polyester fabric. And it can undergo machine washing up to about 10 cycles or so without losing function. And there's a test done by the company that produces it in Arizona. And so to a limited extent, it can be reused. I would say between 10 to 12, machine wash cycles.
Okay. And where are you in the process of getting this to market?
So you see, most cloth fabric masks do not require to go through a regulatory clearance process because there is no health benefit claim to them. In this particular case, the fabric is claiming to neutralize the virus, and therefore it has to go through a regulatory process, and that process has started, and we are currently working with the FDA and getting guidance from them as to how to comply. So the company is working with them, and I'm providing my scientific guidance and information that the FDA needs. So this is called the emergency use authorization process, and we will see when that ends. And what is the final result? Based on that, the fabric should be able to enter the market.
Okay. And then what other PPE? Could this be used also for gowns and other equipment besides the masks?
Yeah, essentially, there should not be any limit to using it. What you have here is a surface where, upon contact, the virus is neutralized with respect to its ability to infect. So therefore, it starts with the mask. You don't need a lot of fabric for that, and the need at this time is dire. So once that need is met, the question would be, can it be scaled up to make other PPEs, including gowns?
All right. Well, Dr. Sen, thank you so much for joining us.
Thank you for the opportunity.
Gary, back to you.
All right, Barb, thanks very much.